Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chalemi. In this episode, what we're going to do is we're going to take a deep dive into plantar fasciitis. So we're going to really explore the complex condition of it. We're going to break it down. We're going to give you some practical information. So today's episode is all about a condition that it really does impact millions of people worldwide, plantar fasciitis. So whether you're an athlete, a healthcare enthusiast, or someone dealing with heel pain, this episode will definitely shed some light on what the definition is, some of the causes, the diagnosis of the associated conditions, some conservative and non-conservative treatments. So we're going to touch on also daily life and strategies for prevention. This is going to be your ultimate guide for understanding plantar fasciitis. So let's dive right into it. What is plantar fasciitis? Plantar fasciitis is one of the most common causes of heel pain. It's a condition that results from the inflammation of the plantar fascia, which is a thick fibrous band of connective tissue that runs along the bottom of your foot. So it's basically the thick part inside your fat pad on the bottom of your foot. The plantar fascia connects the heel bone to the toes, creating the arch of your foot. It also acts as a shock absorber and provides critical support to the foot while walking or running. Let's get into the specific definition of plantar fasciitis. So it can be defined as an inflammation and or micro tears within the plantar fascia due to repetitive strain, leading to localized heel pain, particularly during the first steps of the day or after periods of inactivity. So that's the typical classic definition of plantar fasciitis. We're going to come to learn there's a few different nuances in that. But to understand about plantar fasciitis, you actually have to know the anatomy of plantar fasciitis. Let's get into the anatomy of it. So when we take a closer look at the anatomy of the foot, the plantar fascia is the key anatomical structure that plays a role in biomechanics and weight distribution, how you balance. Layers of the foot is divided into three different layers. You have bones comprising of your heel bone, which is your calcaneus, the metatarsals, and the phalanges. Those are all the little bones in your foot. Muscles. You have intrinsic and extrinsic muscles that help with movement and stability. There are several small muscles associated within the foot itself. And then you have fascia, which includes the plantar fascia, which is one of the strongest connective tissue in the body. The plantar fascia structure consists of the three distinct bands: medial, central, and lateral. So medial means middle or on the inside. Central is kind of right in the middle. Lateral means on the outside. So you have inside, middle, and outside. The central band is the thickest and most clinically significant band because it usually bears the most stress during activities like walking or running. The biomechanical role. The plantar fascia helps in multiple ways. Arch support, keeping the foot arch stable during standing and walking. Shock absorption, it distributes the load and impact forces across your foot. Energy efficiency, it stores elastic energy during toe off in walking, reducing in muscle fatigue. So when we ask, well, how common is this? Who's affected by it? When we talk about that, roughly 1 in 10 people, so 10% of the population, will develop plantar fasciitis at some point in their lives. So 10% of the foot-related medical visits are due to plantar fasciitis. That's a lot. More than 2 million Americans are treated for plantar fasciitis every year. It is most common between adults between 40 and 60, or athletes who are engaged in sports like running or basketball. Professionals with prolonged standing, such as teachers, and or factory workers. What are some of the risk factors when we talk about plantar fasciitis? So first thing we're going to talk about, because it's between 40 and 60, obviously age, right? The risk of increases with age due to natural wear and tear of the body. Obesity. Obesity, the excess weight places additional stresses on the plantar fasciitis and the whole entire foot itself. Foot mechanics, flat feet, dropped arches or high arches can alter your gait and stress on the fascia. Improper footwear, shoes with poor arch support or cushioning. Occupational demands, such as jobs that require you to stand or walk for prolonged periods. So, funny story is when I used to work in New York, in Manhattan, in the late 90s, a lot of my patients were women who were in all kinds of fields, but all of them, 90% of them wore heels, and they wore heels for the past 25 to 30 years. And what ended up happening to these young ladies was their foot actually changed the arch. So when they would go home, it would actually be a problem for them to put their foot straight down on the floor without wearing shoes. So think about it. You go home, you have a long day, you take your shoes off, and you can't flatten your foot out because you've shortened your ligaments, actually. So what happens in that case is they actually train their ligaments over time to shorten, because for 10 plus hours a day, they were in heels. And that caused the ligaments to actually shorten, which is a big problem and caused them a lot of pain. One of the things I want to talk about now is one of the biggest things that I see with plantar fasciitis, and that's heel spurs. So a heel spur is a bony growth or calcification that develops on the underside of the heel, typically the calcaneus, near the attachment of the plantar fascia. It's also, the heel spurs are very closely related to plantar fascia. So you have your fascia here, and you could have like a hook on the bottom of it, and that's going to be a heel spur. And usually when you have that hook's going to dig into the plantar fascia and cause a lot of pain. So we typically see on x-ray, we could see heel spurs, and they usually a small bony projection extending from the calcaneus, usually slightly downward. Typically the size and shape can vary, but generally measure a few millimeters to centimeters. But those few millimeters and centimeters dig into you, and when you stand on your feet, it hurts. It's important to note that heel spurs are frequently asymptomatic, meaning one side, and they do not always cause pain or discomfort. The presence of a spur on imaging does not necessarily correlate to the intensity of the pain. You could have a little tiny heel spur and cause a tremendous amount of pain, or a large heel spur to cause no pain. Everybody's just so different and what affects them. There may be sometimes considered an incidental finding because the foot's not even bothering them, but you took the x-ray for, maybe you're looking for something else and you saw it. But it's something that maybe in the future can cause a problem. So what are some of the effects and associated conditions? Typically pain. Heel spurs can cause pain because they're irritating the surrounding soft tissues, such as the plantar fascia, right? So that makes sense. When you have a spur, you're going to irritate the area around it. Plantar fasciitis, most patients with the heel spurs exhibit tenderness, swelling on the bottom of the foot, especially after periods of inactivity or upon walking. Mobility issues. In severe cases, symptomatic heel spurs may limit your ability to walk, stand, run, do daily activities. It can affect your whole entire life. And chronically over time, heel spurs may worsen and may become an indicator of repetitive strain or chronic inflammation of the plantar fascia. So it might irritate and keep happening over and over again. So the different treatment you do, you might treat it for a little while and it might keep coming back. So what are some of the daily effects on life from from plantar fasciitis. So the hallmark symptom of plantar fasciitis is sharp stabbing pain in the heel, often described as needles under the foot. Pain is usually the first thing noticed. And sometimes when you get out of bed, you put your foot down on the floor for the first time, you'll get a sharp stabbing pain. That is one of the hallmark signs of it. Another sign is after long periods of sitting or inactivity, and you go to stand, you'll have that sharp jolting pain. Or during intense activities like jogging or jumping, you'll come down on it and you'll feel that stabbing pain. So what are some of the effects on mobility? So when you have plantar fasciitis, it can affect your ability to walk or stand for long periods of time. It can make it very difficult to do recreational activities like sports, hiking, or even casual shopping. And I know for everybody out there, casual shopping, that's a problem. I know. That is a big problem. If we can't go casual shopping in today's society, now we're talking about a problem. Okay, mental and emotional effects. Plantar fasciitis can contribute to chronic pain, which can contribute to frustration, anxiety, and even depression, right? Nobody likes to be in pain. It hurts, doesn't feel good, doesn't make you want, it makes you want to not do things. You don't want to go out. You don't want to see people. You don't want to take those walks. So pain can really affect you. It can cause social isolation because you really don't want to be around anybody. So what is how do you get plantar fasciitis? How does this even happen? So plantar fasciitis is often considered an overuse injury, meaning it occurs mostly with repetitive stress, leading to micro tears in the fascia. Unless you get a spur, and then the spur just develops over time, whether it's just because your body developed the spur, or you had instability in your walk, or you had part of your ligaments were changing your biomechanics. Something changed in you and caused that spur to start developing. So causes, some of the intrinsic, biomechanical, flat feet, high arches, tight calf muscles, right? Age, degeneration. As we age, our fascia and different areas around your fascia deteriorate, and that can cause more irritation. Extrinsic causes, right? So sudden increases of activity, like you start training for a marathon, and now you start to overuse your feet. Unsupported footwear, like high heels or flip-flops. I gotta just tell you this. I was in the gym today. I saw a guy with flip-flops walking around, lifting weights, got on the treadmill and was running. I just got to shake my head. I don't understand. How could anybody with flip-flops on the treadmill? Not just a little tiny walk. He was walking and jogging. I just sometimes you have to shake your head. And these are the type of conditions that start, like you don't think about it, but you need to have the proper footwear for your tasks at hand. One of the other causes, hard surfaces, like walking on concrete or like a hard floor. How do you diagnose plantar fasciitis? So getting the correct diagnosis is essential for your treatment, right? So typically, as always, a great physical exam is important. So your doctor must do a great physical exam, identifying where the location of the pain, usually at the heel, identifying your tenderness, your swelling, your functional limitations, and diagnosis with x-rays ruling out heel spurs or fractures. You could do ultrasound to evaluate the thickness or the inflammation of the fascia, and MRI are used in severe or chronic cases. So what are the other conditions that are associated with plantar fasciitis? So one, we already know, heel spurs, right, which is calcium deposits that form underneath the bone, often causing one of the main causes, or one of the bigger causes of plantar fasciitis. Achilles tendonitis. So when you have Achilles tendonitis, the Achilles tendon can aggravate the heel because the Achilles is the largest tendon in the body, and when that gets irritated, or when that gets tension, there's too much tension on it, it could definitely affect the heel spurs. Arthritis. So like rheumatoid arthritis can inflame the fascia. Obesity, extra body weight, heightened stress on the fascia, contributing to chronic pain. Treatment options for plantar fasciitis. So conservative treatments. So rest, limit your standing, limit your walking, limit your high impact activities. Ice therapy, apply ice packs to reduce inflammation. Stretching exercises, calf stretches, toe stretches, wall stretches. Orthotic device, there are different custom inserts that can help cushion, put an extra layer of cushion underneath your heel to help you. You can get ones that are made by the podiatrist, or they have ones in a variety of different stores. Sometimes you can get one of them in the store just to temporarily help you get over that initial pain. Night splints keeps your foot stretched in a position for overnight. Medications you can use, if this is conservative treatment now, still NSAIDs, non-steroids like ibuprofen. And obviously, one of the biggest things that I'm going to look at is physical therapy. So targeted exercises that can strengthen the foot and prevent relapses, strengthening the intrinsic foot muscles, myofascial release techniques. One of the other things that you could do is they have something called shockwave therapy, which can help. It's high frequency sound waves used to promote healing in the fascia. And lastly, I'm going to go into a little bit of detail on this is plantar fasciitis and PRP treatment. It has come a long way, and over the last few years, this has been one of the bigger breakthroughs in treatments for plantar fasciitis, especially in my office. This is one of the biggest things that we use to help treat plantar fasciitis. So PRP, what is that? Platelet-rich plasma. So it's a regenerative medical treatment that harnesses the healing properties of the patient, your own blood, by extracting a small amount of blood. We put it through a separator, a centrifuge, and when you do that, your typically red blood cells and your white blood cells get separated. They all go drop to the bottom. Your platelets are on top. Your platelets have your proteins, your growth hormones, your stem cells. There's all your good cells in it. In my office, we call that our liquid gold. Usually, these platelets are then injected. We have a specific formula that we utilize in our office. So depending on where it is, where the plantar fasciitis actually is and what's affected, we have a variety of different techniques, but we do those injections in that area, and it really stimulates a great amount of healing by the body. And typically, patients, even after post-treatment, are advised to rest for a few days, and improvement in pain and function is usually observed within several weeks. Sometimes it could take up to a month or so to heal, but when we're doing it this way, you're not getting surgery, you're not getting drugs, you're getting natural solutions to your condition. Usually we do this in combination with physical therapy, so it really makes a large difference in how you actually heal. So one of the studies I was looking at as the effectiveness of PRP therapy, studies on PRP therapy for plantar fasciitis have demonstrated promising results. In this study that I have here, 131 people were tested with PRP injections. Over 93.57% of the cases showed improvement. They showed reduced heel pain and improvement in functionality. A 2025 review noted that PRP effectiveness in treatment musculoskeletal conditions, including plantar fasciitis, by triggering the body's natural repair system. Pretty cool stuff when you actually see it in action, and you see a patient really benefit and heal from PRP and regenerative medicine, and they don't have to rely on drugs or surgery. It really is life-changing for people to know that they've healed themselves, and it's a totally different journey than a traditional medical journey where you're going to get, I'm going to go over this in a second, but steroids or surgery. If you can heal yourself, it's pretty magical. So some of the benefits of PRP, obviously it's non-surgical, non-invasive. It's a regenerative type of healing, focuses on the body's own ability to heal. And it's very, very minimally invasive, right? PRPs are typically done in the office. We do them in our office, and there's no downtime to it. So what are some of the non-conservative treatments, right? So first, corticosteroids. Corticosteroids are used to reduce inflammation, but have side effects, including weakness. They weaken the fascia over time, and that can lead to more tearing and drying out. Surgery is usually the second option, and that's reserved for chronic resistant cases. So plantar fascia, and by cutting the fascia, they try to relieve the tension in there. So what are some of the strategies for prevention, right? Using proper footwear, invest in good shoes with good arch support and good cushions. Weight management, healthy weight management is always great for minimizing strain. Stretch regularly, include calf and foot stretches in your daily routine. Cross training, go between high impact and low impact sports. Let me give you my closing thoughts on plantar fasciitis. So plantar fasciitis may seem like a simple condition, but it can have a significant impact in your quality of life. By understanding its causes, diagnosis, and treatment options, you're better equipped to address heel pain and regain mobility. Whether you're actively dealing with plantar fasciitis or simply aiming to prevent it, knowledge is power. With all my podcasts, I like to say the information you received here is my opinion alone. This is not meant to be any treatment or medical advice. Please see your own professional for your own condition. Thank you so much for taking this deep dive in with me for plantar fasciitis. If you or anybody you know has plantar fasciitis or has heel pain, they might not even know they have it. Please pass this along to them. It's a quick listen. Wasn't that long today. Give it to somebody who you love, friends, family member. And as always, I say, we have this one thing we have, which is health. You only got one of these, which is bodies, right? Take care of it. Do the best you can. Because as always, health matters. I'm Dr. Chillemi. Till next time.